my fiance Dan, my daughter Brinley, and my mom, the camera woman. In the spring of 2006, Rebecca Lawson was a healthy, athletic 17-year-old girl, a senior in high school, an honor student, and an active member of the swim team. One day, Rebecca started complaining of a sore throat, and after a couple days and a low-grade fever, she was taken to her pediatrician and diagnosed with mono. A few days later, with her fever higher and complaining of back pain, she was taken to the emergency room where she was diagnosed with pneumonia. 2 days into her hospitalization, doctors informed her parents that they had isolated the cause to MRSA, an antibiotic-resistant strain of bacteria. Rebecca's condition continued to worsen over the next 4 months, and she was in the hospital during this entire time, and 4 months later, she did pass away. The killer, MRSA, an antibiotic-resistant strain of bacteria. This is Rebecca. And unfortunately, Rebecca's story is just one of many on the Infectious Disease Society of America's website. According to the World Health Organization, effective prevention and treatment of a number of infections caused by bacteria, fungi, viruses, and parasites are being prevented by antibiotic resistance. Without an effective means of treatment, we are all at risk of contracting one of these superbugs. Most of us have been prescribed antibiotics at some point in our life. Some of us may have really needed it, whereas others may have just thought that's what they needed to get by. Some take prescriptions home and take enough just to relieve the symptoms, and they save the rest for another time, or they share with their family the next time one of them is ill. Antibiotic resistance is a serious health concern with potentially deadly consequences. If we do not find a way to prevent further antibiotic or antimicrobial resistance, a simple illness that was once treated with an antibiotic may become a deadly illness. In order to better understand the prevention of antimicrobial resistance, it is important to first understand what antimicrobial resistance is, what causes this resistance, and how we can prevent it. So what is antibiotic resistance? The Center for Disease Control defines antibiotic resistance as the ability of a bacteria to resist the effects of an antibiotic. There are many different types of antibiotics available, but they all work in one of two ways. Medical News Today states that an antibiotic is either bactericidal, which means the bacteria is killed by the antibiotic compromising the cell wall and killing the contents inside the cell. The other type of antibiotic is bacteriostatic, meaning that the antibiotic stops the bacteria from multiplying. Antibiotics are effective against bacteria, fungi, and parasites. Viruses are not affected by antibiotics. And according to the CDC, the most antibiotic-resistant deaths occur in inpatient settings, such as the hospital or nursing homes. So now that you know what antibiotic resistance is, you may be wondering what causes it. An article on the Mayo Clinic website lists overuse of antibiotics and problems following instructions as one of the common causes of antibiotic resistance. Mutation of bacteria, overprescribing of antibiotics, misuse of antibiotics, use of antimicrobial hand soaps or antibacterial hand soaps, and availability of online doctor visits, meaning a patient is able to go online and do an e-visit where they describe their symptoms and they're prescribed something without actually being tested or seen. This is an example of one of the antibacterial soaps. And these are found all over and probably in every household. Now that you know what antibiotic resistance is and what causes it, we need to know how we can prevent it. With the proper use of antibiotics, we can prevent further antibiotic resistance. Take them according to the instructions. Completely finish the regimen. Don't save them for later use. And never take somebody else's antibiotics. And most importantly, don't take antibiotics for viral illnesses. ABC.com posted an article containing research that showed just under half the soaps on the market contain antibacterial properties. While there is no research proving that antibacterial property is beneficial to cleansing, there is, however, research that proves that antibacterial property in soaps can be harmful as the body is rid of good bacteria, and it also contributes to antibiotic resistance. Soap and water without the antibacterial property is best. Next time you are ill, talk to your doctor. Take antibiotics as prescribed and finish the regimen. Avoid antimicrobial soaps and use regular soap and water. These few things can prevent antibiotic resistance. So next time you're ill, talk to your doctor to determine if antibiotics are really necessary. If they are, follow the instructions and finish the course and stay away from antibacterial soaps. Choose a soap that does not have antibacterial properties because you could be doing more harm than good. Antibiotic resistance is a serious problem, one that we can do something to stop. With continuing mutations in superbugs, we do not want to run out of options for treatments. So please do your part and help prevent antibiotic resistance.